We can do a eval, hip eval for anterior hip pain. So we're gonna have patient stand up, start with a general postural assessment. So from anterior view, looking ASISs, looking for symmetry there. You can check iliac crest from this view as well. From a lateral view, checking for any knee recurvatum, lumbar excessive lordosis, or thoracic kyphosis. Looking at head posture, everything looks pretty good there. Then we're gonna have face the window. General here is looking, palpating PSISs, looking for asymmetry. Again, iliac crest. That's all looking pretty good. Can check, get a feel on the trocaners as well, and kind of assess a general asymmetry there. That all looks pretty good. Looking knee valgum, varum here. That looks pretty good. Overall, looks pretty good there. Next, I'm going to have her do just a single leg stand. Just checking for Trendelenburg sign there. Hip drop, compensation with the trunk. Looks good. You can switch legs. Same thing looking for there. Looks pretty good. Next, just for a functional assessment, I'm going to have you do a squat. And just generally assessing from both views, lateral and front view, looking for a quad dominance, knee valgum, varum. Her squat, go ahead and squat again from the side view. Pretty good overall, maybe a little bit more quad dominant with the knees coming over the toes a little bit. From the front, looked pretty good, wasn't any excessive valgum or varum or knee instability. And then upper body looked good with the squat as well. Next, I'm going to have you lay on the floor. Body mechanics are not going to be great in this video because I don't have a table. We're doing it on the floor. So just going to check some general hip range of motion here. So I'm going to have you just actively lift that leg as high as you can. Good. And again, looking for pain with all these, so assessing that as we go. And then I'm going to have you kick out to the side as far as you can. Good. And then we're gonna move this leg in a little bit, and then I'm gonna have you pull in as far as you can this way. Looks good there. All those look really good. While she's laying down too, before I do any passive range, I can also just palpate, get on the rectus femoris here, the TFL here, and IT band. Check those. The greater trochanter bursa. Check those for pain, reproduction symptoms. Can get in here as well on the pubic symphysis and the ramus here, and kind of check those for pain, reproduction symptoms. We're going to say minimal pain there. And then I'm just going to take her passively through some range of motion. And we check all this on both sides as well, but checking some range here. I think we all know the landmarks by now. So again, mid-thorax. And she's got 140 degrees there. Going greater trochanter as the axis. And then we're going to check. You can leave this leg in here. We're going to check adduction. So, and then I pull her out as far as you can. We're going ASIS is there, down to the superior pole of the patella. And she's about 40 there, which normal is 45. For hip flexion, normal is, yep, now we're going the other way. And I passively take her there as well. There. And she's about 38 there. And then we come back. I'm going to have you flip onto your stomach. We can do internal rotation, external rotation too. That'd be easier sitting up. Don't have a great chair for that because it's not tall enough. And then just have you kick that leg up as high as you can. Back down. Good. And then looks pretty good there. Her flexibility looks really good. So I don't think we need to check any of that necessarily. And I'm going to lift her up as well. This one, and again going on greater trochanter, mid-thorax there, or abdomen. Lifting up here. And again, body mechanics are not great because we're on the floor. So she's about 30 degrees there, which is normal. Okay. while she's in this position, I'm just going to go ahead and do a posterior to anterior glide on the head, just to check mobility. So that felt pretty normal. Normal feel. Go ahead and flip around and just get back again. I'm going to do just a quick anterior posterior glide here on the hip. And any pain, checking for pain as well on these.
A little bit.
A little bit of pain there, a little bit of pain with the other one. And then again, we can go for a lateral glide. And this probably will feel a little bit better for her. Feel okay? Okay. So that one felt a little better. A little pain with the post PA glide. I'm going to slide this over this. Alright. And then flexibility looked good with all the active range, so I don't think necessary to check any of those. As far as MOT goes, I'm going to pull over a chair. And then I'm going to check iliopsoas right here real quick. So I'm going to lift this knee up, hold it there, don't let me push down. Okay, relax there. I'm going to check internal and external rotation as well. For the iliopsoas, I'd probably give it a 4+. It did break a little bit. And I checked the other side as well. And that side was a little better. So 5 there, 4+ here. And then I'm going to check internal rotation. So I'm going to hold her leg off the floor a little bit because we don't have a high enough table in here. And so I'm going to push you in, resist it. And don't let me push you in. Good. And then don't let me push it out. Good. So 5+, or 5 out of 5 for both of those. Alright, now we're going to go back on your back here. Alright, and so I'm going to do a couple special tests to kind of along what I'm thinking. So just starting with a Faber. So you're just going to relax there. Push here. Does that cause pain?
No.
Yeah?
A little bit.
Okay. And is it in the front of the hip, same spot? Okay. So since that was causing pain, let's see if we're still going. Okay. That caused pain. I'm also going to go into a scour, and I do have the sensitivity numbers for those. So for Faber, sensitivity is 0.71 to 1.0. Specificity was 0.41 to 0.99. And we're looking for concordant sign as well. So since she had more pain in the anterior hip, we're going with hip pathology, potential labrum. And then to kind of second test I'm going into, we could definitely do more tests, but I'm going to go scour test. And for the scour, the sensitivity was 0.75, specificity was 0.43. So for this test, taking her up into flexion, adduction, and then I'm just going to take her through that range up to about her full range down to about 70, 80 degrees here, and back at the full range. If that doesn't really reproduce symptoms, I'm going to add a little more pressure down through the hip. And looking for any clunking, catching, and then reproduction of her pain, which it did cause reproduction of her pain. So kind of, again, rolling in, going along with my thinking of kind of hip labral pathology in the anterior hip there. Or in the labrum of the hip. All right, I think that's it.